All right. Hello.
Hello. Good morning.
Welcome. Empowered Chats is back. We are back with a transformational coach, Jen Orman, and perimenopause, menopausal expert extraordinaire, Kelley DeFilippis. We are ready to go. This is, I think, part 5, because this is a conversation that needs to be had, is going to continue to be ongoing, and we're just not going to stop talking about it. So today I'm really excited because we're going to be talking all about perimenopause. So Kelley's going to really get down into it and explain what that's all about, and we're going to be speaking to women, younger women. But we all need to know about that. So, but before we get started, let me properly introduce myself. I am Jen Orman. I am a midlife makeover coach. I am a transformational coach that helps midlife women who are waking up and saying, what do I want to do when I grow up? Who do I really want to be now? And we get to we get to uncover beliefs that may be holding you back. We get to literally create new avatars of who you want to become and where you want to go. And, if you're saying, I think that I missed the boat, I'm too late, I made bad choices and I can't move forward, that is absolutely untrue. So we are moving forward, and with incredible women every single day going forward. And if you want to get in and get some inspiration and kind of get a little taste of how things are going, I have a challenge going on right now called the Get Your Goal Challenge, GHOUL. And it's only 15 days. Today's our 5th day, but I'm closing I'm keeping the enrollment open because people kept joining all week long, and the feedback is so great. It's an audio challenge. Every day you get an audio in your email box, and you get an email with inspiration, exercises, things to help you focus on a goal that's important to you, that you want to move forward before the end of 2025. So it's super easy. It's $15. And so you can't lose. If you want to join, reach out to me. I'll get you the link and we can do that. But okay. Perimenopause. I'm going to introduce Kelley, and she's going to tell you all about her. And Kelley is literally a rock star. She is helping so many people in the Pittsburgh, Ohio, West Virginia areas. And she is helping women who have been gaslit, who have been gaslighting themselves, and we don't even know it, right? Because we have aches, we have pains, we have things that are going on. We have, why can't I think clearly? We have, the brain fog, we have itchy skin, like all different things. And it keeps we have dental issues sometimes that get dismissed. And these are the women. These are us. These are all of us, right? And we feel that we're not seen, that we're not heard, that we're dismissed because we're not. And Kelley's going to tell you why that is and why that's changing, and why she's the one that can help you move forward and literally change your life. Why does this matter to me? Well, because I'm a midlife woman myself. I've been, I'm postmenopausal. I've had my own challenges and issues that kept me sidelined for years myself. And these are our most productive years when we're talking perimenopause as well. Like these should be our most productive, joyful years. We don't have time to sit on the sidelines, right? We are here to do things, and there is help and support for the symptoms that are coming up and that we're experiencing. And it's time that we as women take responsibility to get educated for ourselves, to become our own best advocate. And Kelley, I just adore her, and her passion is second to none, and her expertise is second to none. So without further ado, Kelley, take it away. Tell everybody who you are, what you do, where you work, and how they can find you. And then let's talk about perimenopause and what we can do to help women.
So I am Kelley DeFilippis. I am a board certified nurse practitioner. I am also a perimenopause, menopause/hormone specialist, trained by many people. and part of the North American Menopause Society, or really it's just the Menopause Society now. I work at Cornerstone Wellness Center, that is at 1000 Cliff Mine Road in Pittsburgh and Robinson. I help women transition through perimenopause into menopause and postmenopause. And we all thought menopause was just a single thing. It's not. Menopause is a third of your life. It is 20 to 40 years. And once you are in postmenopause, you are there for the rest of your life. And we will dive further and deeper into all of that. But there's a lot of misconceptions about what menopause is, because it's so newsflash for everybody. Menopause is one day. Menopause is a single day. It is 366 days after your last period. It's a really crappy definition. The reason that it's a bad definition is it leaves out an entire group of women. So what about the women who've had a hysterectomy? When's their day of menopause? What about the women who have an IUD? Though, they're not having periods already. So when's their day of menopause? What about the women that have some medical reason why they're not having periods? When's their day of menopause? What about the women who have maybe aren't having periods because of medications? When's their day of menopause? So menopause is defined as 366 days after your last period, and it's one single day. And everything before that, leading up to that, is perimenopause, which we're going to discuss. And everything after that one day is postmenopause, which we can also discuss. Maybe not today, but we'll get to it. But really what it should be called is hypogonadism, which is a loss of hormone production from our sex hormones. That's what we call it in men, is hypogonadism. If they lose the production of their testosterone, we call it hypogonadism. But in women, we call it menopause. But it's really just one day. It's an entire year without a period. But like I said, that leaves out a whole group of women. And so so let's talk about perimenopause and what that is. So, and why it happens. So when we are, as women are born, we are born with all of our reproductive material. So we're born with all of our eggs/follicles that are in our ovaries that give us the ability to produce children. Men, we're not men. Newsflash. Men make their reproductive material every day, aka sperm. Women, we are born with ours. The other thing that there is a misconception about is that our ovaries make the hormones. The ovaries play a big role. There are nerve endings and sensors and things that send signals back to the brain, and they are active, but it's actually the eggs inside of the ovaries that make the hormones. So that's why this is important, that we're born with all of our eggs. We're born with about 1 million of them. By the time we hit puberty, we're down to about 500,000 eggs. By the time we're 20, we're down to about 200 to 300,000 eggs.
Wow.
By the time we're 30, we're down to about 100,000 eggs. At 40, we're down to about 25,000 eggs. And at 50, we're down to about 1,000 eggs or less. This is important because remember, it is the eggs that make the hormones. The eggs/follicles that make the hormones. What we also need to realize and understand is that just because, and people are like, well, how do they go down so far just from birth until puberty? Well, because cells die. That's all eggs are. They're cells, and cells die. Cells die every day in our body, and skin cells die and slough off, and red blood cells die, and we make new ones. Yeah. The problem is we don't make any new egg cells. We don't make any new ones. We're born with them, and they slowly decline. what else people need to understand, women need to understand, is that we do ovulate 1, maybe 2 eggs in a month, but we get ready, our body gets ready between 500 to 1,000 eggs a month, and only 1 is the chosen one that makes it out of the follicle and goes into the fallopian tube for potential reproduction, for fertilization. So as we are aging and as we are running out of eggs, it causes a decline in our hormone supply, specifically in estrogen, progesterone, and somewhat testosterone. Testosterone is made in 2 places. It's made by the eggs in the ovaries, but it's also made by our adrenal glands. So testosterone never falls completely off a cliff like estrogen and progesterone do, because it's made in 2 separate places.
Can we talk either now or later about the myths of testosterone, that only men have testosterone and women don't, and the importance of it at some point?
So newsflash, men have estrogen.
Men have estrogen.
Men have progesterone. It's just men have 10 times the amount of testosterone that we do, but we still have it. In all actuality, whenever we are at our peak of reproduction, so like in our 20s, we have more testosterone floating around in our bloodstream than we do estrogen. That's what makes us horny teenagers and 20s.
Amazing how that all works.
Yeah. But so in our teens and 20s, we actually have more testosterone floating around in our blood than we actually do estrogen and progesterone. Testosterone is a very important hormone for all of us. And the thing about these hormones that you have to understand is they're more than just about sex, babies, and periods. They are in every body system. So they're in our brain, they are in our skin, they are in our blood vessels, our heart, our gut, are everywhere, from your hair follicles to your toenails and everywhere in between. We have receptors on our cells for these hormones. What are hormones? Hormones are messengers that tell the cells how to function normally. Whenever the cells aren't getting these messages on how to function normally, they start to function abnormally. And that is what gives us the symptoms of perimenopause, menopause, and postmenopause.
Okay.
Because, and the reason we need to understand postmenopause too, is because once you're done having periods, that's actually the period, the cessation or the stopping of periods is actually a symptom. It's not the root cause. It's a symptom because there's no more eggs left. There's no more hormones. So the process of building up the uterine lining and shedding it stops. When that stops, that means there's no more eggs left. So there's no more hormones. So in postmenopause, you're living in a perpetual hormonal deficiency, hypogonadism.
Wow. That's something to think about. I mean, if we haven't receptor cells for hormones in every cell of our body, brains, every system, and then all of a sudden that hormone, they're not there. They literally come from here.
Yeah, I mean, they don't go away overnight. But from the age of 40 to 50 is a profound, rapid loss of our eggs for many reasons. One, they're getting old. I mean, they've been in there since we were born. So they're not as healthy as they once were. They don't live their life cycle. They don't live as long. Plus, we ovulate or get ready anywhere between 500 to 1,000 eggs a month. And so it's from 40, approximately. Some women it's earlier, but approximately from around 40 to 50 is a rapid decline of our egg supply, and therefore a rapid decline of our hormones. And like I said, these receptors for these hormones. So think of it like this: you have a keyhole and you have a key. The receptor is the keyhole. the hormone is the key, and that hormone goes in there and turns that keyhole and opens the door.
Wow,
So if
that's
there's
a good
no
question.
more keys coming, then that part of the cell is like basically locked up.
Wow.
Does that kind of make it?
Yeah. Yes.
So there's no more keys. You got to open the door, but there's not a key to do it. There's because the hormones aren't there, and those are the messages that go into the cells and tell the cells how to function normally. And so whenever they're not getting those messages, then things start to get kind of screwy. A lot of women think that perimenopause happens much later than what it does. So
yeah.
Menopause, like we said, is 1 day. The average age a woman will go through menopause is 51. That's the average. But a woman can go through menopause anywhere from 45, sometimes even earlier, to around 57. The symptoms that come with perimenopause due to that declining of the egg supply and the declining of the hormones can happen 7 to 10 years before you stop having periods. And those 7 to 10 years of the rapid decline of our hormones is called perimenopause. So if a woman is going to stop, and we have no way of knowing exactly when a woman's going to stop. I mean, I'll be honest with you, I'm going to be 53 in 2 days and I'm still having periods. But for some women, they stop having periods at 45. That woman can start having perimenopausal symptoms as early as 35. My youngest patient who is having perimenopausal symptoms is 33.
Wow.
So women will go to their doctors and be like, I'm having hot flashes, I'm having these, and they're like, were you having periods? And she's like, yeah. And I'm like, well, then you're all right. But she could be experiencing the symptoms of perimenopause because we don't know when she's going to stop her period. Sometimes, like people say, or doctors will ask, well, when did your mom stop having periods?
Yeah,
well,
that's a common one.
So that can be an okay gauge of knowing when you might stop. And if there's like this like persistent kind of family history, grandma stopped her period at 43, mom was 45, odds are you're probably going to be in your 40s too.
Yeah.
But there's no absolute way to predict it or decide. Women will come in all the time asking, well, check my hormones, or they go to their doctors, something's wrong. And the doctor goes, okay, we'll check your hormones. Check her hormones. The doctor comes back and says, they're normal. Well, that's because one, a normal estradiol level is anywhere between 30 and 500. 30 to 500. That's huge. It's not like 30 to 100. No, it's 30 to 500.
Wow.
And you're going to be in there somewhere. But the problem is with perimenopause, and because there's not enough eggs, the brain keeps sending messages to the ovaries saying, hey, get these eggs ready. And the ovaries going, but there's not enough of them. So then the brain keeps pushing. We can have these huge fluctuations of our hormone levels. So when a doctor, when you go to the lab and you have your blood work done, it's literally for that second that needle is in your arm.
Mm-hmm. Yeah, that moment in time.
An hour later, it could be different. If we recheck it the next day, it could be totally different. So at that moment, when he drew your blood work, it was normal, but also remember normal's between 30 and 500. So like you can't really check the hormones during perimenopause because and the other thing I hear too is, well, I was told I was estrogen dominant. Well, okay, maybe that day your estrogen was high, but if we check it tomorrow, it might be low. Like it's not, you can't really check blood work in perimenopause because it's so erratic and chaotic.
Okay, so what can they do? What can we do when we're in perimenopause and we're experiencing it? First of all, let's talk about the different symptoms that you see, that you're treating, that you're listening to women talk about in their 30s and 40s, maybe even early 50s before actual menopause. What are you helping them with?
Well, so there's 60 symptoms. Not every woman is going, and okay, so let's go back. So in early perimenopause, so say, so for me, I use myself as my own example a lot. So I was about, I was about 42 whenever I started having symptoms. When you first start having them, they're kind of fleeting and kind of hit and miss and sometimes kind of inconspicuous. And we really are good at like shrugging them off onto other things. Well, I didn't sleep good last night because, well, you know, I got a bunch of bills due, or I got a big project due at work, or the kids had me upset, or your parents, whatever we're really
it's
good
just
at
stress. It's just normal. It's just stress. Yeah.
We're really, really good at giving reasons for the way that we feel.
Yep. Gaslighting ourselves.
Yeah. So, but as we start to get older and the symptoms become less fleeting and less inconspicuous and become more consistent, we still give excuses for them. So one of mine was, I never had a hot flash in the traditional sense of the word and what people imagine a hot flash being. So we imagine a hot flash being like, it starts in our core and it just kind of grows and gets real big and we sweat and we get red. And I never had that. I was just hot all the time. So in my 20s and 30s, I slept in warm, fuzzy pajamas. And in my 40s, I had to start sleeping in a t-shirt with just a sheet and had to have my foot hanging out of the covers all the time. My thermometer foot.
I love that. Your thermometer foot.
Yeah. Or like it would be winter and everyone else in my house is walking around in a sweatshirt and sweatpants and warm and maybe a blanket on. And I got on a t-shirt and shorts and saying, who turned up the heat?
Yeah. Wow.
So not all of us experience those. We just experience maybe a 5 to 10 degree difference in our core body temperature. It's just temperature dysregulation.
And this is just because the hormones, the eggs, everything's starting to fluctuate and it's different for everybody.
Our brain is very, very sensitive to hormone fluctuations. And the hypothalamus in our brain is our temperature regulator. And our brain does not like these changes. And so that is one of the reasons why, because the estrogen helps tell the hypothalamus what the thermometer is supposed to be set at. And if it's not getting those messages on what the thermometer is supposed to be set at, then it's kind of like a 2-year-old doing this with the thermostat.
Yeah. Wow.
Because you can have chills too. You can have cold chills. You can have hot flashes.
Yeah. And these are so disruptive. And I think, because it's been dismissed and women haven't been treated properly, and it's just something you have to go through. And I mean, I never had a ton of hot flashes myself, but I know people who have, and I have seen people, suffer, and just in the middle of a work day or in the middle, it's just, oh my gosh, I can't. They can't function properly because it's it's also scary.
I just had a patient yesterday and we're sitting there talking and I was like, so how are the hot flashes? Oh, they're not bad. They're a couple. And as we're sitting there talking and I go, you're having a hot flash right now, aren't you? Well, it is a little warm in here. And I go, it's a hot flash. The temperature in here didn't change since you came in. It's still the same temperature, but you're hotter. And I could see it in her face because her cheeks are starting to get a little rosy. And I could see like little beads of sweat on her eyebrows. And I'm like, so you're having a hot flash right now? No, it's just warm in here. So we're really, 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 really good at masking ourselves and saying, no, I'm not experiencing this. But then we don't even recognize, because it just becomes kind of like our new norm. And we just keep going because it's women. We're women. That's what we do, right? We just keep pushing. We just keep going.
Don't complain. Don't put my needs out there. I'm focused on you. I'm okay. Yeah. No, we have to put ourselves at the top of our to be, to do,
Yeah.
we've got to take care of ourselves first. We really, truly have got to put the oxygen mask on ourselves first. And my gosh, you get to get the support, and there is support for these things. So stop being like, suck it up, buttercup. I'm just going to live with this. We have got to take charge of deciding that quality of life is important for us, and that we must go seek it out and find the people that are going to help us. So what are you going to do? That patient that came in with the hot flash, first, you're going to help her recognize what it was, right? And help her understand.
I always tell my patients, here's what I want you to, because after the visit, and I'm like, I want you to go home and I want you to sit down and I want you to write down how you've been feeling and what symptoms you've been having, even if you don't think they're related to your menopause, because in most cases, they probably really are. I go, and I don't want you to reason them away.
Good, good, good.
I'm getting up at night to pee because I've been increasing my water intake. No, like getting up to pee at night is not normal. Write it down. Oh, well,
did you hear that, everybody? Getting up to pee at night is not normal. Like, I didn't know that until you told me that.
It's common, but it doesn't make it normal. Yeah, it's common, but it doesn't make it, or I can no longer eat yogurt because it upsets my stomach. Well, I must have a lactose intolerance. No, like stop trying. That's the first thing we need to do is one, we need to recognize what is happening to us. So I'm going to read this. And I typically don't read out all the symptoms because there's so many. But the thing is I think that this will resonate with people to go, what? That could be from my perimenopause and menopause. So I'm going to run through these real quick.
Okay.
New or worsening acid reflux. New or worsening anxiety. And these are all new or worsening. So I'm not going to say before everyone. So new or worsening. If you've already had these things and they're getting worse, it could be your perimenopause/menopause. Acid reflux, anxiety, depression, irritability, acne, body odor, phantom smells, thinning hair, hair loss, unwanted hair, joint pain, allergies, worsening asthma, autoimmune disease, Hashimoto's, rheumatoid arthritis, lupus, psoriasis, eczema, either new or worsening, bloating, digestive issues, being diagnosed with irritable bowel syndrome, not being able to eat foods you once ate because they now bother you, belly fat, changes in where fat is deposited, no longer putting on weight in your breasts, butt, and hips, but now it's going like straight to your abdomen.
Yeah.
Brain fog, inability to concentrate, inability to multitask, ADHD, worsening ADHD, breast tenderness, breast fullness, breast lack of fullness, brittle nails, burning mouth, dry mouth, sore tongue, mouth sores, fatigue, tired all the time, itchy skin, crawly skin, dry skin, electrical shock feelings to your skin, decreased libido, decreased arousal, vertigo, dizziness, dry eyes, itchy eyes, eye fatigue, feel like your vision's changing, headaches, new or worsening, migraines, new or worsening, fatty liver, frozen shoulder, plantar fasciitis, back pain, hip pain, knee pain, arm pain, wrist pain, joint pain, all over.
Wow.
Hot flashes, temperature dysregulation, night sweats, cold chills, urinary tract infections, getting up at night to pee, peeing when you laugh, cough, or sneeze, needing to know where the bathroom is everywhere you go, needing to go to the bathroom before you leave the house, regardless of whether you feel like you need to pee. Go into the bathroom and not a lot comes out or it trickles out. Yeast infections, vaginal infections, uncomfortable intercourse, bleeding with intercourse, palpitations, nervousness, high cholesterol, period irregularity. They're heavier, they're shorter. There's a longer interval between them. There's a shorter interval between them. There's lighter. They're closer together. They're different. Like the period blood is actually different. Restless legs, unable to fall asleep, unable to stay asleep, unable to go back to sleep if you do need to wake up, not feeling well rested, loss of muscle, not you're getting the bat wings, loss of muscle, osteopenia, osteoporosis, sleep apnea, tinnitus, ringing in your ears, very common, and more wrinkles.
Woo! Good times. Okay. So you clearly there can be multiple reasons why these symptoms can be happening for people, right? It can be different things.
There could be. So when somebody comes to see me, what I do is I do blood work to rule out the other causes. Are you anemic? Do you have a vitamin D deficiency? Do you have a thyroid problem? You know, do you have good iron stores? You know, check your comprehensive metabolic panel. Are your electrolytes okay? Is your liver and kidneys functioning normally? Like, I check all these blood work to make sure that there's no other underlying reason for your symptoms. And most of the time, there isn't.
Okay. That's what I wanted to say. I was, as you're talking, I'm thinking people are probably thinking, well, yeah, but it could be something else could be causing it. Of course, that's true. Something else could be.
But it could be. So you get blood work done with your primary care doctor like every year, right? Most of us do. I mean, if you have a primary care, you get blood work and they do most of the things. And then when you go, but I'm feeling like this, and they're like, well, all your blood work's normal. It's just aging. I just had a doctor tell that to a 42-year-old woman the other day.
Really?
Who told her it's just aging. And I'm like,
42 years old.
42. You're not 82. Like,
no.
You shouldn't be feeling joint pain and like you're 42.
That's insane. But I want to emphasize your point. I want to emphasize that, well, it could be caused by something else. You're going to rule that out. You're going to find out. High probability that your hormones, your depleting and shifting hormones are playing a significant role, and that when addressed properly, you are going to feel better.
Yeah. So if you're over the age of 40, odds are you're in perimenopause. You don't, and here's the biggest one I didn't mention. Here's the biggest one I didn't mention. I don't feel like myself.
I don't feel like myself.
I don't feel like myself. There's something doesn't feel right. I just don't feel like me anymore.
Yep, I hear it. I mean, I hear it all the time in my coaching clients. I don't feel like myself anymore. I just
don't feel like myself anymore. Or, yeah.
I also said it myself for 5 years or more. You know,
7
years. Yeah. I mean, it might even be longer. You start to,
It all starts to like, it all just kind of starts to.
So what excites you the most about getting to when these women book appointments, whether they're in, and should women in their 30s book an appointment with, does it matter what their age is? Like, are you willing to see everybody? Talk about that. Like, are you?
Yeah, it doesn't really matter. So there's a lot of women too, who are even younger. So I have a couple women who are in their 20s who, are having like PMDD. So, premenstrual dysphoric disorder. Yeah, like left my brain what it is, but so they can benefit from hormone replacement too, especially from hormone therapy, especially during the second part of their cycle. Sometimes they just need a little progesterone during the second. I have one that just wears an estrogen patch because she feels good until that second part of her period, until the second half of her cycle. And then she starts to not feel well. And then 3 days before she starts her period, she really doesn't feel well. So we just use an estrogen patch for 3 days.
Yeah. Okay.
3 days. So, you know, there's other things too, but anybody who is starting to have these symptoms, and don't wait. I mean, you don't have to wait until your periods become irregular. Some of us don't really experience that period irregularity, and period irregularity is usually a later sign of perimenopause. Usually once your periods start becoming irregular, you're anywhere between a year to 3 years of stopping your period. That's really a lot of times a later sign. Earlier signs are just like the anxiety and kind of feeling depressed, or heart palpitations, and or feeling not wanting to be in a crowd, or wanting to withdraw from socialization. Those are a lot
driving
of anxiety. Yeah.
That happens to me.
Spatial awareness, like, you can't, you're not like able to like gauge your car anymore, like odd things like that. And those are usually kind of like, and those are those inconspicuous kind of fleeting things that we just ignore, and we just keep pushing.
Well, and I think that, over centuries, and women, it's been dismissed, and there's a lot of misogyny out there. And we've also, people dismiss themselves because it's like, oh, she's just a, brain fog, just that's the caricatures of like midlife women, and the disrespect that has been, really put out there. And then we take it on as like, well, I guess that's just the way it is. It is not the way it is. Like,
well, we need to change the face. Like, we need to because when you say the word menopause, most people think of a little old lady.
Yeah.
And that woman is probably postmenopausal for who knows how many years, but perimenopause starts so much earlier. And we really need to recognize that. And perimenopause isn't something that has really been discussed or talked about. I'm going to throw some statistics at you here really quick. Okay. So perimenopause really hasn't been researched at all. Okay. And don't quote me, but I'm pretty close on these statistics. So for pregnancy, there are over 1 million research studies about pregnancy. Menopause, there are like 98,000 research studies. Perimenopause, there's like 20.
Wow.
Yeah. And so when you say menopause, people think of the little old lady. And when you say perimenopause, they don't know what to think of, because it's never really been, and just until the last 3-4 years has it really been kind of a term that has been being used and that is being recognized. We don't have enough research on it, but we can extrapolate from things that we know about pregnancy and about fertility and things. We can extrapolate. Right. And then also things that we know about menopause, we can extrapolate to perimenopause. And women will be told all the time, well, you can't, and the thing that gets me is so many women will go to their doctors and say they're having these things, and they're like, well, let's just put you on birth control.
Yep. And explain why that's not.
So here's why that's not. Let's go back to those hormone receptors, right? So birth control is similar to the ethinyl estradiol that is in birth control, is similar to what our body makes, but it isn't exact. So if you use the analogy of the keyhole in the key, ethinyl estradiol that is in it, that's in birth control will fit the hole, but it won't turn the lock.
So what's the point?
Right. So it fits in there, but it can't exactly tell the cells how to function. So because it fills the receptor and fills it kind of and disguises itself. It can be helpful for some women, but for other women like myself, I was on birth control at 42, 45, 47, and I was still having all of these symptoms. it wasn't helping because it doesn't turn the lock.
Yeah. Wow. That's a great visual. That just makes
fits in the hole.
Yeah.
It fits the keyhole, but it can't turn the lock.
Wow. Incredible. I'm thinking, it feels like, first of all, it's exciting to be alive at this time. So we get, the menopause and perimenopause, we are just lighting up the world, and the menopause is growing, and people are becoming aware and waking up, but change does take time. And it makes me think that people, because our medical establishments and school universities and things that, they were never taught this, and it's still not on a lot of medical.
But then in the, they were
with the back with the the 2002.
It all stopped in 2002.
Right. Okay. Right. Yeah. Which we've talked about on all these other, which is important to understand about the what's it called again? The WHI?
Women's Health Initiative. Yeah, it was the Women's Health Initiative. It was a study to try and show that hormone therapy was actually, so hormone therapy has been around for, I don't know, since the 30s or something. I mean, it's been around for forever. And in the 1980s and in the 1990s, it was the 5th most prescribed medication in the world.
Yeah, that's such an important piece of remembering all
of And in 2002, when this press release, it wasn't even the study that was released, it was the press release that was released saying that basically hormones bad and estrogen causes a 25% increased risk of breast cancer, which it doesn't. All education, 80% of the people who were taking their hormones flushed them down the toilet. Doctors quit prescribing them. Education stopped. And it's been a travesty. It's been a travesty for women ever since. It's a disservice to women. And the thing is, if it was true, we should have seen the cases of breast cancer decrease, and we haven't. We've only seen them increase. Yeah. And all of the things that were, all of the bad stuff, there were some good things that came out of the WHI too, but that one bad thing has been walked back time and time and time and time. The problem, it's been walked back, it's been restudied, it's been reanalyzed. The problem is none of those made the media. They didn't make the news headlines like the original one did. So it's still stuck in people's mind. Hormones cause cancer. So I like to do an analogy for people. So most women have taken, the majority of women have taken oral birth control. No one ever told you that was going to cause breast cancer. Hormone birth control, average dose of ethinyl estradiol in birth control is 20 milligrams of a synthetic hormone every single day, 20 milligrams. Hormone therapy, the medium dose is 0.05 milligrams of body identical 17 beta estradiol. Yeah. If 20 milligrams a day of synthetic ethinyl estradiol that goes into the receptor but doesn't turn the lock is okay, why isn't 17 beta estradiol that fits the lock exactly and turns it bad? Yeah. Wow. Education. Let's keep sharing the information. It's yeah. And in the WHI study, it was conjugated equine estrogen that was used, which was made from pregnant horses' urine. We don't really use those anymore. I've never prescribed them. I only prescribe body identical 17 beta estradiol or estradiol. And even in the WHI study, women who took estrogen, the conjugated equine estrogen only, had a 30% reduction in breast cancer and a better survival rate if they did get it. The problem was with the progestin that was used, which was medroxyprogesterone acetate. And that's where the problem was. And I don't know, I've never used that either. And I don't know anyone, I don't know any menopause specialist who has. Wow. Well, you got to And
Keep
then
preaching.
I just took a patient off Prem Pro the other day. I was like, "You're taking what?" She's like, "I'm taking Prem Pro," and I'm like, that's the conjugated equine estrogen and the medroxyprogesterone acetate combination pill." And I was like, "Why don't we try something else?"
I mean, do you get shocked every week though? I mean, about when women are coming in and saying, well, this is what
I get shocked every day. Not just weekly, like every day. I get it. The things that doctors say to their patients, you know, like I just had a 42-year-old woman who had started hormone therapy with me, and she went to her PCP for just her yearly thing, and she thought it would be a good thing for her to tell her PCP. And he was like, "Well, what are you taking that for? You need birth control." And she's, "What do I need birth control for? I have a tubal." And he didn't have an answer for her. So instead he said, "Well, if you want to give yourself cancer, go right on ahead."
Yeah, it's just.
And she's like, "If I didn't know better and I hadn't been educated by you and you didn't give me all these resources," she said, "I'd have been scared to death and I would have stopped."
And that's why what you're doing is so important, and what we're doing to get everybody, you know, share this with people that you know and love. Share. We've got to all come together and get this information out there en masse, and it is happening.
Other thing I want women to be really, really, really aware of is there are predators out there. There are predatory companies out there who are saying that they do, you know, that they do the same thing that I do. They don't. Of course, I'm not going to mention any company in particular, but there's quite a few of them in our area.
Right here in Pittsburgh. And
yeah, right here in Pittsburgh, all through the area. And I had a woman. She was on a patch. She was on progesterone. She had lost her provider, retired. She went to one of these companies. They immediately took her off of her patch, told her that it was bad for her, told her that it wasn't bioidentical, and put her on their own compounded hormones that she had to buy from them. That's a red flag if they're not using your insurance, because there are bioidentical hormones that are covered by your insurance.
Yeah,
if a company is telling you that you can only get it through them and that through them is the only safe way, that is a red flag. Also gave her a testosterone injection. Why injections are needed for a very small few amount of women. The majority of women can do testosterone topically. There is no FDA approved testosterone for women. So, and it is also a controlled substance. So if they are just giving it to you out of their supply, I would be questioning that. Does that provider have a DEA license to be able to provide that to you? You know, there's lots of red flags there. Also, if they're telling you you have to have blood work done every month, every 6 weeks, every 8 weeks, and can only get it done through them, you can't use your insurance to have it done. That's also another red flag. And there are a lot of these companies around in this area. When I do hormone replacement therapy, I use hormone therapy. I do use all body identical hormones, with the exception of testosterone. It's body identical, but there's no FDA approved body identical testosterone for women yet. We have to get it compounded through a compounding pharmacy but I do have a DEA license. I can do it legally. And I use your insurance to pay for your blood work and any tests and all the medications that I prescribe. I use your insurance. Now, if your insurance doesn't cover it, that's not, there's not anything I can do.
You can only do so much.
I can only do so much. But you know, there are FDA approved versions of these things that these other companies, you know, say there isn't. and that they're not body identical or bioidentical. They absolutely are. And so I just want people to be cautious. I'm not saying everybody has to come to me. I mean, you got to choose your own. I'm also not saying everybody needs to do hormone replacement therapy. I mean, it's your own, it's your own journey and it's your own decision. Will it make symptoms better? Yes. Will it help protect you and reduce your risk of chronic conditions as you age? Yes, it will. But
yeah,
I just want people to be aware. If they want to charge you an exorbitant amount of money and you can only get the medications from them and you can only get the labs done through them, those are like red flags.
Yep. Thank you for sharing that.
They are, you know, ask them. I mean, we all know who the menopause is. Do they? Because the patient even asked them, like, well, do you know who Mary Claire Haver is? They're like, no.
Wow.
I mean,
that would be a red flag for me.
That would be a red flag for me too.
How do you not know? That
would be a huge red flag for me. You know.
So Kelley, you see, how old is your youngest and how old is your oldest patient?
My youngest is in her 20s. I can't remember her exact age. 27, maybe 25, 27. And my oldest patient is 86.
86.
Oh, and she doesn't have a thing wrong with her. She doesn't have osteoporosis. She doesn't have heart disease. She was driving her own motorcycle until 2018.
That is the coolest. That is amazing.
She's so cool. She's so cool.
It feels like wouldn't it be an amazing thing to happen if we all, you know how we go to the dentist like twice a year, everybody goes to the dentist twice a year, although that's getting harder because that's a whole nother story to find the dentist. But anyway, to find, like, as a proactive scenario, to see you, if you're having, you know, any questions, concerns, just to start to understand your body more as a female and how, you know, what's normal, what's not normal, and just to have baselines and things like that. Wouldn't that be amazing? I mean, but most practitioners are not necessarily set up for.
Well, here's the problem. Our healthcare system, period, our insurance system, our whole healthcare system isn't set up for preventative medicine.
Yeah, we are.
It is set up, you know, it's catastrophic care. It is sick based. So, you know, you have to have a whole shift in the whole kind of healthcare medical institution. It's going to take a long time for us to even get menopause. I mean, to get perimenopause, menopause, and postmenopause into medical curriculums, it's going to take a lot of time.
Yep, it is.
Unless you have somebody who is either, you know, I mean, I'll be honest, I wouldn't know anything about this had it not affected my own life profoundly. Menopause, I think perimenopause profoundly affected my life. I mean, as a primary care provider, I had, 1,600 patients I was in charge of taking care of. And I up and quit my job because I didn't feel like I could handle it anymore. And my favorite thing to do was sit in a dark room and stare at a wall. So, you know, it was only because I quit my job and then got a job where I wasn't really busy. And I honestly, though, I didn't even start researching perimenopause or menopause. What I started researching was how to lose weight, because I was usually I was about 140 pounds and I ballooned up to 185. And I was blaming all my hip pain and my hotness and my, you know, all of the things, a lot of the symptoms that I was having on the fact that I gained 40 pounds. So my thing was, I was just looking to like lose some weight. And I came across this book called The Galveston Diet. And it was written by this Dr. Mary Claire Haver. And in it, it talked about menopause. And it was the first time anyone had connected those dots for me. It was the first time it was on paper that the symptoms that come with menopause. I had no idea. I was never taught. I was taught it is the decline of, a woman stops her periods and she might have some hot flashes and then she's fine.
Yep.
I had absolutely no idea that all of these symptoms were a possibility. And it was from that book that's whenever I started really, really researching and finding out, like, what? Like, I get
Honestly, it's like the best kept secret, because it's still shrouded in silence. It's still not talked about. Even you talked about earlier, like how sometimes the doctor will say, well, when did your mother, when did her period stop? How many people even know? How many moms ever talked about it? Like,
let me tell you something. You asked my 83-year-old mother how, because my mom just said this to me the other day, and I don't think my mom really understands what I do. She's 83. She like, whatever. She's like, so how'd you get into all this? I go, well, because I was having a lot of symptoms, Mom. Like, I wasn't feeling myself. I was hot and I was depressed and I was anxious and I was like disconnected. And she was like, I sailed right through that. And I thought to myself, you're out of your mind, because you were like a rabid dog. You would be nice one minute, and then the next minute you were biting somebody's head off. I can remember you being hot. I can remember, she totally forgets anything that happened to her during that.
Of course we do, right?
Yeah. So and so don't ask your mother about it, because she's going to tell you she was fine.
Yeah, exactly. Yeah.
You remember she wasn't fine. I remember mine was not fine.
Yep. Oh my gosh. That's a great story, because I think a lot of people can really relate to that. And we forget, for sure. Yeah. So, all right, let's wrap this up here and let's keep this conversation going. This is so important. We want to help women. Kelley, talk about how women can come see you, and then share. We have a couple of announcements. You have some things coming up, starting with the M Factor for tomorrow, and then some of the other things that you're doing, and then we'll wrap it up.
Yeah. So if you want, if you want more information, you have questions for me before you decide if you want to work with me, you could call our office, 724-371-0177. I will do a complimentary free 15-minute consultation with you. You get to ask your questions. I won't give you any specific personal medical advice, because at that point you're not my patient. But if you decide to work with me, then you get your first visit is 90 minutes with me. So make sure, if you're going to make an appointment, you carve out that time, because it takes that long. You won't get that with your primary care. So you can also find me on our website, www.cornerstonewell.com. Or you can call the office. We actually have a whole team of women. We have a registered dietitian. We have physical therapy, pelvic floor therapy. We have an intimacy and relationship specialist. We have trauma therapy. We have a whole group of women to help women. And if we don't have it there, we'll find somebody. We know somebody who has what you need. This weekend, what's going on? Okay, so tomorrow night is and you can sign up for this for free I believe, on Tamsin Fidel's website. It is World Menopause Day, and she's going to be having a bunch of the menopause specialists on there. She's also going to be showing the second part, or the new part of the M Factor documentary. If it's not something you've ever seen, I highly recommend it. You can stream it on PBS. It's called the M Factor. Amazing documentary. And so she's going to be doing more parts to it, because it really started the conversation. Let's see, next weekend, next Saturday, and I don't know how many tickets are left to this. But if you go to www.capacitysymposium.com, I will be a speaker at that event. I will be speaking particularly about menopause and menopause, why it happens, and and then there'll be other speakers there. There's doctors, there's another nurse practitioner. My registered dietitian that I work closely with is going to be a speaker there. I think it was yesterday, there was only 5 tickets left for this event. So get yours, don't miss out. Starting November 7th at Cornerstone Wellness, we are going to be doing a book club. Our first book that we're going to read is Estrogen Matters by Dr. Avram Blooming and Carol Tavris. Tavris. I always say her last name wrong. Sorry, Carol. And I don't know her, but I'm sorry anyways. We're going to be discussing chapters 1 through 5 of that book at that meeting. If you want to become part of the book club, you can email office@cornerstonewell.com, or you can call the office at 724-371-0177. The reason I chose Estrogen Matters, it is the book that made me go, that's it, I'm done. I am getting on hormones. I have been lied to. I have been misled. I have been uneducated, and that is the book that changed my mind and made me go, that's it, I'm getting on hormones. And then what else? November 16th. Wait, let me make sure I'm right.
Yep. You said, with Tanya Cheney.
Yeah, with Tanya Cheney. We're going to be doing and if you go to my Facebook page, Kelley DeFilippis, you can look at this. I have a flyer on there, I believe, and I'll repost it. But we're going to be doing a talk. Tanya is a massage therapist. She's also holistic type of healer and into fitness and nutrition and those sorts of things. So we're going to be doing a menopause talk. That's going to be in Monongahela, but we're also going to live stream it.
Awesome.
I think that's all I have right now.
I think that's phenomenal. All righty. I think we are. I'm just looking at my notes. I think that's it. Yeah, I think we've got it. So women, no more suffering in silence, no more self-gaslighting, no more. There is education to be had. There is information to become informed.
And I want to say one more thing. This is it. This is all I'm going to say. You're never too young and you're never too old.
Yep. Absolutely.
Stop letting people tell you that. You're never too young. You're never too old. Like I said, I treat women age 20, and my oldest woman is 86. And you're,
yeah. And it's just a myth that we have to suffer. And I was listening to something today, and I'll end with this because I love it. It's stop waiting for your golden years. Create your golden years today, here and now. And if that doesn't start with feeling good, I mean, I don't know what it starts with, right? And there is support, there is help, you can feel better and you deserve to, but you need to take the lead and search out the truth, and people like Kelley who are on top of the current data and are here to support you ethically and accurately. Yeah. So Kelley, awesome. Thank you. Stay tuned, guys. We're going to keep moving forward with this. So yeah, we will be back. All right. Bye, guys. Have an awesome weekend. I would say go Steelers, but that was a rough one last night.
Last night. It's my birthday. Celebrate my birthday.
Your birthday. Happy birthday in 2 days. The 19th.
On Sunday.
Fantastic.
I'm 53.
Happy 5-3, lady. Very good. All right. Thanks for listening, guys. Share this out with people. Do your part too. Get the word out. There is help. All right. Bye-bye.